Okay, here is your level 3 reflexology routine. I'm going to speed it up a little bit so that you're not watching for ages and ages or for the whole time. You can pause it to do a little bit more. I'll try and do it as to pace, but you might want to add more. Sorry, just looking at my mouth as I talk. So yeah, I'm going to do it at pace, but it might not be as many repetitions. That's what I'm trying to say, is you might want to do more repetitions. Okay, so first things first. So the client would be with the blanket. You can just tune in with your hands over the blanket or the towel, and uncover. Okay. So yeah, you can read the feet and assess the feet and see what the colour and the texture and the temperature. And then place your hands on and thumbs on the solar plexus point. Just tuning in for a moment. And then we'll just get some balm. Kind of using about that much balm. Oops, just realised I've got my jewellery on. So the Effleurage is 2 over the top and then sandwich underneath. And 2 over the top and sandwich underneath. 2 over the top. Yeah. So I'm just going to come to one foot and warming up. Foot rotations in both directions. Heel of the hand over the top. So unfortunately I haven't got over the top cameras. So I'll just describe what I'm doing, but I'm using my fingers to just warm up through the metatarsal spaces and the dorsal aspect of the foot. Some ringing, or the Chinese burn as we like to call it. Coming up, and everything flows. Toe twirling, a little pull. Toe twirling, little pull. And then our thumb strokes, like a zigzag or circles. So you can do, this is nice, or this. Palm of the hand. So one hand on top on the dorsal, and one hand just does like palm circles. Pull and push. And push. And then opening up the zones, and I'm using my knuckle, I'm using that middle finger to lead all the zones, and I can already feel what's going on. Nice and slow so that I can feel what's going on at zone 1. and 2, 3, 4, and 5. And then just knuckling, plantar surface, hand stays over on the dorsal to support. And then ankle jiggles. Little effleurage. And come to the other side, just warming up, little effleurage. Circles. And the other way, rotations. Heel of the hand over the top. And I'm just using my fingers through the metatarsal spaces. A little rub. Come to ringing. Oops, can you see? Quite tricky there. Can't see. And toe twirling. Toe twirling. Let me see. Thumb strokes up the plantar surface. Might just have to move that slightly so that you can see. Oh god. Sorry. Does that help? Yes, that's a little bit better. Palm of a hand. Nice relaxed fingers. Pull and push. Push. And push. Pull. And then opening up the zones. 1 to 5. 2, 3, 4, and 5. Little transition into knuckling. And ankle jiggle. Okay, so I'm going to just cover this foot for now. And we're going to move on to your client's right foot, which is on your left, which is the beginning. I'm going to come to the big toe. So that was 9 minutes. You can see on the video that's a good 9 minutes. So you could possibly get it down to 7 without, I think I was chatting for a couple of minutes at the beginning, so it is around 5 to 7. So I'm just thumb walking up the big toe. You can do sort of 5 lines here. You can do 2 rounds, two times. If you consider doing everything twice, definitely. And then a 3rd time if you come across and feel anything. So that's all the head and brain. Hypothalamus and pineal and brain coming up the medial and over the top. up and holding the toe here, holding the toe steady, up the medial and over the top, up and over the top. Yeah, so I'm doing that a good 5 times just so you can see that. And then I'm going to the neck at the base of the toe. You see that? Yeah. Around the base of the toe. And then, because I can feel a little bit of a nodule there, I'm going to get my stone. I'm using this stone today. You can use the carnelian piece that I've showed before, but I'm using this stone today. I'm using this little part of it just to get in. You feel that? So this is the neck. I can feel like little gristly granular texture through the stone for the neck. In fact, it's all over the neck here. Sometimes it's only ever local in this little bottom corner of the toe, but actually I'm feeling it quite a lot through the base of the toe, all through that neck reflex, especially there. Give that a little rub. Keep the stone with me. And I'm going to do the pituitary, make a knuckle and press. Pituitary. Then I do over the front for the face and the teeth and the front of the neck. I'm just doing little finger actions. Thyroid parathyroid, you can just put your thumb down there, or in fact, as we say, you can use the stone. Or if you've got a stick, you can use your stick. And my new baby. How beautiful is that? You can press here on thyroid. And then we're going to be working through all the toes, which are the eyes, ears, eustachian tube. So I'm going to rub, rather than thumb walking, because it's such a small area, I'm just going to rub at the base, and then the pad, and then a press on the tip of the sinus reflex. So let's go to the next one, rubbing. So often if clients have eye issues, these feel quite nodular. And then the pad, and then the top tip, which is the sinus point. Good for allergies, hay fever, sinus congestion. And the pad, and then the tip, and then the same for the painkilling. Press and press on the swap. And then I'll just go through each toe again and just do the dorsal aspect of each toe. I'm going to take my stick or my stone and I'm just going to press in between each toe. Okay. Just going to do a little walk through the padding at the base of the toes, just to finish off all that eye, ear, sinus section as we move on to trachea, thymus, bronchi, and I'm working up, up, up this reflex point. So I'm working this section here, which is the thymus, trachea, bronchi, and then we go into the lungs, which is that main section there. So any respiratory issues, asthma, shortness of breath, bronchitis, respiratory colds, and strengthening the lung qi. So all the time strengthening lung qi. When we do and study 5 elements, we study a lot about the organ qi system, with the eyes corresponding to liver energy and the ears corresponding to kidney energy. And the lung also manifests in the skin. So as well as working the lung organ, we're working lung qi and the 5 element metal correspondence chart. Coming over to the shoulder, just at the edge here on the lateral border. I feel a little bit of crunching in there. My posture's a bit rubbish because I can feel it in my body, kind of twisting a little bit, but just for the sake of your video. Anyway, I'm right here on the shoulder and I can feel a bit of crunching there. Okay, I'm going to walk through the diaphragm line one way and the other. I am actually going a little bit quicker. I would probably go at this pace. I'm just going a little bit quick because I feel the video is already 15 minutes and we've got all the way to go. So I'm just going to slow down a little bit just to show you the pace of it. Not the pace of it, but the pace of my treatment. Okay, then we're going to go to the liver region. So below the diaphragm line and above the waistline is liver. Caterpillar forward and pull back. Caterpillar forward and pull back. You can see, I can actually see visually where the stomach reflex is. Pull back. And pull back. So this client's foot's got quite flat feet, so it's not as obvious actually where the narrowest point of the foot is for the waistline, but it's definitely around there. And there's the diaphragm line. Also the colour of the feet is quite consistent, but I would say that's the diaphragm line there. And that's the waistline there. So the liver reflexes is within this. So you can do it twice round. Pull back. And pull back. And pull back. We're just leaving this little section here because this is the beginning of the stomach. And pull back. Okay, and then I'm going to do a little bit of knuckling here. Nice big surface. So you can either do it with this hand or whatever feels right for you. And I'm going to take my stone. You could also use your lovely tool here just to sweep, sweep, sweep. And then just working the foot. I can definitely feel that's quite congested. This tool's just fabulous. Oh yeah. The tool feels really nice and it's very smooth, but it's also got that hard edge to it that's really lovely. Just give that little rub. So that's the beginning of the stomach. So people with acid reflux and heartburn tend to have quite painful stomach. Most of the stomach, as we know, is on the left side. It just starts here on the right. Okay, then we're moving now below the waistline. There's the waistline. There's the pelvic line. And in this area here, we've got the small intestine and large intestine. We're going to go back or side to side. I always say back and forth, but it's actually side to side. It's a little bit low. Let me just elevate this up. Do give me something to lift the foot up so that you can see. So I'm just going side to side. And then here again, the stone is so lovely. Just pushing down. I don't go up and down, I just go one direction. And then we're going to go up the large intestine. I'm just going to push up the large intestine and across. Push up. And across. Up and across. Good. This is great for clearing the large intestine. Good for constipation. Clearing the large intestine. Going to kidney. I'm just going to press the foot back. It just reveals this nice ligament line through the centre of the foot. And then, can you see, I need to get this really well and clear. Is I use the heel of my hand just to push back the ball of the foot. And then I swing underneath to locate the adrenal. Just going to activate the adrenal. And can you see my hands come round? So from that position here of pressing back, my thumb swings round and my fingers relax over the dorsal aspect. That's the adrenals. And then I'm going to come just slightly more to the mid-line of the foot and massage. That's kidney. And then I'm circling. So I don't do finger walking or caterpillar here. I do little circles as we come down ureter. And then out just towards that little spongy, puffy protrusion that's bladder. Yeah. Okay, just do that again. Adrenal, kidney. And this usually does actually feel quite tender for lots of people, just because of the adrenal fatigue and stress and adrenaline, sympathetic. Okay, amazing. Now we're going to come to the heel. The heel's always quite a dense area, quite a tough area. So I'm just going to definitely come straight in. I don't do any thumb walking here. I just use my knuckles the whole way. One thing I've just remembered that I forgot is the gallbladder and the liver area. I might come back and do just that in a second. And I'm going to take my stone and just work down and work down. Work down. And then I'm just going to roll through the sciatic line, the sciatic nerve, right through the centre of the heel. I'm going to just roll and press. So just before, I just remembered that I forgot the gallbladder when we were doing liver. So I'm just going to return, and it's just in that, if you see the liver there, it's just in that lovely depression. Let's take our tool and just press. So it's just remembering to do these little points as you go along. The heart's another one that often gets forgotten. Okay, you can see that nice natural depression there that leaves an imprint where the gallbladder is. Great, so we're going to move on now to the reproductive. So I'm going to keep my thumbs here on the heel, and my fingers are bilaterally soothing out the reproductive areas on the inside and outside heel. And then what I'm going to do, let me just see if I can get this. Let's move this a little bit. See if I can just move this over like that. Will that stay? No. Anyway, what I am doing is I'm doing this bilaterally, and then just like getting very focused in on this uterus prostate point, and on the other side it's the ovaries and testes. So halfway between the malleolus and the heel, the midpoint, that's the point there. So you can use any finger you like just to get very focused in on that point. This is totally contraindicated during pregnancy, but excellent for preparation for fertility. Did I say contraindicated during pregnancy? Yeah. But great for fertility and also great for labour. And then I'm going to do it here just so you can see. Then we're going to go up and over. This is the fallopian tubes or the vas deferens. Up and over. Amazing. So I'm now going to bring the camera back to here. So I just swing you around. Just lower that a little bit. Yeah. So fingers here. I'm smoothing round, getting very close, and the same goes on this, just on this lateral point, just into the points, ovaries and testes this side, up the fallopian tubes. And then I'm going to go round the ankle bone. It's really nice round the ankle bone, which is the kidney meridian, and also spleen meridian and liver meridians all around here, just massaging all around the ankle. It's really nice. And just a little bit of Achilles, squeeze on Achilles. And then I'm going to come either side, and I'm using my 3 fingers. Again, it's really difficult for me to show you with the without different camera angles, but I'm working all the limbs. So the knees, hips, well, the knee, leg, arms are all up the side. But to make it feel really nice, I do both sides like that. But it's the reflex points are all laterally. On the medial is the spine, but this is all the limbs. Coming up to the top, I'm just using my 2 pointy fingers to do little circles for all the lymphatics. So this is lymphatic drainage through the metatarsal spaces. This is all the lymphatics. Amazing. Okay. And then just a little drainage. So between the first and second also is to consider that these are the thoracic ducts. And also when we then we're going to do the dorsal aspect here is all the breast chest intercostal space. And then we start working on the spine. And the spine, I use my knuckle, this part here, not so much like that, not so much that, but it's more this part. And I'm rubbing, starting from the top, this is the spine, and I'm rubbing all down the spine. And just be clear in that you're working along the arch, the medial arch, and not along the foot, because if you go straight down, you then come back onto the reflex points of the plantar surface of the foot. So you are actually contouring the arch of the spine, which is how the spine goes naturally anyway. So I'm rubbing along the spine, and then when I come up, I'm also having the intention of working the cisterna chyli, and you can come up and then do a little bit more work through the thoracic duct. Is quite nice. You can use the heel of your hand, and also being mindful. The spine, this inner medial part is for me is really key, because you've got the spine as the vertebral column, you've got the erector spinae muscles, you've got the spinal column and the spinal cord. You've got all the peripheral nerves that extend from the spinal cord. You've got cisterna chyli that runs up. You've got the aorta and veins, that the descending aorta, and there's so much that goes through that central part and central cavity of the body. And then you've also got the chakra system. You've got the governing vessel and the, oh, there's a nice little bit. You've got the governing vessel and the conception vessels that also go. You've got just a lot of energy, the Kundalini energy that rises up and encircles the central column. The Sushumna in yoga with the Ida and Pingala energy. So I like to work this medial border loads. I think it's a really, so I've got my stone now. I'm just doing little, I do keep my hand in touch. I'm just taking it away so you can see what I'm doing. Little rubs. You can do sweeps as well. And I go up and down because energy goes up and down through, energetically it actually spins, but certainly up and down would be really good. Amazing. Once I've done that, I'm going to do some nice effleurages to close. So this has been half an hour. What I'm going to do on the other side, I'm going to walk through it, because on the other side there are a few exceptions which I will point out. So I'm not going to do the full treatment. I'm just going to show you the exception, not the exceptions, but the differences and differentiate on each side. And so you would uncover and just see where you're at with balm. This feels absolutely fine. I'm going to go straight in. I'm just going to slightly change my angle so that you can see what I'm doing. Let's move that over. Oops. Sorry. Oopsie. Is that good? Yeah, that'll do. I'll just change my angle a little bit. Yeah. So we would start again with big toe. So I'm going to walk you through this. There's big toe, and you can do 5 lines, the 5 zones, and then up and over the top, up and over the top, neck, lots of it, pituitary, and thyroid parathyroid, press, each toe, little circles, the pad and the tip, each toe, the base, the pad and the tip, each way, and then the front. So you can do the front. I'm doing the front of all of them now together. Okay, coming down here. So now again, repeated is thymus, but this side is esophagus. So you're going to work through what would be the ball here, which would also be again esophagus and bronchi, trachea, moving into the lung. I'm just going to walk it through here. Sorry for the pace. So this you can just sort of watch and then maybe go back to the beginning to follow the pace of it. Shoulder, shoulder, lovely crunchy shoulders, marvellous. And then here you have the heart. I almost didn't remember, but then I did. So heart is sort of nice, of this oval area here, like a hook. You can hook. Let me show you. It's kind of nice that you can get that. That's a nice little press there. Can't see what I'm doing. Can you see there? Nice for the heart. And as we discussed on training, heart is often the Shen and spirit, and can often be affected by anxiety, depression, lack of trust in relationships and with yourself. So the heart doesn't always mean the heart organ, it can be heart energy. And now this is the difference. So now rather than the other side being liver, this side we have below the diaphragm. You'd walk along the diaphragm one way and across backwards. And then here below the diaphragm line and above the waist is the stomach reflexes. You've got stomach here. So I'm going to just walk across stomach and pull back. walk across the stomach and pull back. And I'm kind of going 3/4 of the way across because we know that we've got spleen and pancreas over on that lateral side. So I'm only going to the middle waistline and come back. I'm going to do that a couple of times. Stomach, pull back, stomach, pull back, stomach, pull back. Good. I hope you find a way of working with this video so that this is more to real time. I'm going to walk down. This is spleen and across for pancreas again. So from the diaphragm line is the beginning of spleen. I walk down to the waistline and then across, which is where pancreas is. So there's the diaphragm, there's the waist, that's all of stomach, that's spleen, and that's pancreas. You can also do nice big circles, so massaging all the area, stomach, spleen, pancreas, before you then move on to the small intestine. So we're going to move down below the waistline, backwards and forwards, backwards and forwards. I'm just going to walk this through so you know what you're doing here. Backwards and forwards. And then here we've got now the transverse colon continued, because there on the other side we have the ascending and transverse large intestine or colon, ascending and transverse, and here we have the other half of the colon, which is transverse and descending, and then that swoops round. Apologies, my video just cut out there, sorry about that. So it would have blended to the transverse and descending colon, transverse and descending, and then it swoops round, which is where we cut off, onto the rectum and anus. So I can definitely feel, I can use my, it's like a dolphin, isn't it? Is it a dolphin or a bird? And that way, it's a great tool. I think it's like a dolphin. So here, actually the dolphin can go that way. It's brilliant, it can sort of roll along the transverse and down and down, down the descending. Again, this is great for people who have digestive disorders, any sort of IBS, inflammation of the large intestine, and then things like leaky gut. All this area is brilliant. IBS, leaky gut, constipation, and then I'm swooping round and swooping round, and actually this rectum and anus swoops round into the pelvic line, so it goes a little lower than where the colon area, if you like. It does swoop round, and then the rest, I'm literally going to go quite quickly through this now. Knuckling the heel, lots of it. Use your gua sha you can scrape around the heel and across. Use your stone, you can come up with it. Be creative with your stone to work the heel, but I would avoid using your thumbs on the heel. It's such a dense area. Knuckles, gua sha, the cup that the spoon cup that I've showed you on training, that little ramekin was amazing. That's quite good. Yeah, it feels a bit smooth rather than a harder edge, which is quite welcome here. So something like that's good. And then along the sciatic line. Yeah, moving on. Actually, we didn't do the kidneys, so kidneys here. I got a bit distracted with that video being cut off. So heel goes back, or the heel of my hand, not the heel of my hand pushes the foot back. I would be supporting, but but I've got my hand out of the way so that you can see. I'm just pushing back, and my thumb just sits at the top of this ligament line and just presses on the adrenals. Get my hair out of the way, and then coming down, kidney. Oh yeah, I can feel that. Can you feel that? I can feel that would hurt. Not that I'm smiling. But then comes down, ureta on this side, and comes out towards this nice spongy puffy area here. It's a bit tricky because I'm not sitting square on, I'm sitting twisted round so that you can see this, but foot goes back, thumb comes round, finds adrenal, and then my fingers relax, press on adrenal, and then circling down towards kidney. Yeah, can definitely feel that. And like we discussed, is that it's a little bit tricky that sometimes you might be working other reflex points that the kidney crosses, like, for example, the stomach area and the top of the small intestine, and you might feel something there. But if you know definitely that it's along this adrenal kidney, ureta, bladder line, then you definitely know that it's more a kidney. And this adrenal and kidney ureters suffer with stress from the adrenals, stress and sympathetic nervous system, busy lifestyles. Adrenal kidney can be over protein metabolic processing, so meat eaters with the uric waste coming through the kidneys and filtration, but also hydration and dehydration can present here with little with quite a tense feeling, little crystalline deposits, and then of course quite a puffy bladder. So then you would be doing the heel and the sciatic, coming on to the reproductive organs. Thumbs here, just rest, fingertips massage nicely and smoothly, moving in almost like a spiral, if you like, into those lovely points, medial and lateral for the ovaries and testes and the prostate and testes. So the uterus, ovaries, prostate, testes. Yep, and then coming up this natural depression where the talus joint is, like a natural depression. I'm using my fingers to walk up there, and that's the fallopian tubes and vas deferens there, little rub here, nice. And then around the malleolus, lateral and medial, which is certainly around the Achilles for the anatomical positioning, but also we've got liver, kidney, spleen meridians on the medial aspect of the foot here, so I give those an extra little rub. And coming up to Spleen Six here, which sometimes I can't help myself but have a little press of Spleen Six. I can feel that natural depression. You locate Spleen Six by putting your finger right on the highest point of the malleolus and do a whole hand span, and just off the tibia is Spleen Six. Little press. You feel that? No? There.
Back a little bit.
That way. That way.
Oh yeah, there.
So again, slightly different because it's measured in Sun measurements, and actually the Sun measurements are individual. So actually with guys, it's probably a little larger than for ladies, just because of the longer limb, if that's the case. So you work the measurements of the whole, but we're not doing that, we're doing reflexology. The limbs, again, it's on the lateral. You won't see this here, but I'm working either side just because it feels nice. But on the lateral aspect, the lateral aspect of the foot are the limbs. It's the knees, hip, elbow, arm, leg coming up. So you can have a look at that on your chart. And then I'm just going to come right up over the top and just working into the lymphatics, onto the metatarsal spaces. I really take a lot of care to do that. It's quite an important aspect of reflexology. You can do little circles as well and drain. And then use the heel of my hand for the dorsal aspect, which is the chest and breasts, intercostal spaces to come up, and then be working on the spine, which just in the previous foot I explained in detail the importance and aspects of working this medial arch, as it has so many lovely associations. So this is good for any sort of musculoskeletal, spinal and nervous conditions, so really helped to calm the nervous system. The other thing is, like we've said, is working all through these points here, is that where the vagus nerve leaves the cranial nerves and then extends down through the respiratory system and the heart, the digestive system, certainly the liver and the intestines, and then you're working the medial border. The vagus nerve is totally addressed, toned and stimulated during this, which enables the parasympathetic to calm the body right down. So, ways to close. Finishing off with a nice effleurage. Take my tools away. So I like to just uncover and then I will recover. But I uncover to connect with the solar plexus points again. And I do the long, deep breathing. I know that lots of you like to ask your clients to do the long, deep breathing, but I do it myself. And know and trust that the entanglement of my energy with my client will also transfer to them to calm their breath. Place my hands on each foot, the plantar surface. If you are a Reiki practitioner or any sort of energetic visualization or prayers or blessings can be welcome right at the beginning and then right at the end. And then I'm going to cover up. And oops. Cover up. And then just again with the towels on, just make that final connection. It's a disconnection, in fact, where you're, there we go, nice big yawn from the client as we transition into rising up. And I thank you so much for watching.